Now, in this section, I will discuss about the muscle attachment of the humerus. Some muscle are originated and some are inserted on the humerus. The multipinate, the subscapularis, is inserted on the lesser tubercle, and the supraspinatus is inserted on the uppermost impression on the greater tubercle. We know in the greater tubercle there are the three impressions: the upper, the middle, and the lower impression. From the upper impression, the supraspinatus is inserted, the infraspinatus is inserted into the middle impression, and the ladies minor is inserted into the lower impression on the greater tubercle. Next muscle is the pectoralis major. Pectoralis major, it is inserted on the, there is a two lip of the in the distributor root, the medial lip and the lateral lip, and the pectoralis major is inserted into the lateral lip, of the intertubercle sulcus, and the insertion is bilaminar. In the latissimus dorsi, next is the latissimus dorsi, it is inserted in the floor of the intertubercle sulcus, and teres major is inserted into the medial lip of the intertubercle sulcus. Now the content of the intertubercle sulcus, what are the content? First content is the tendon of the long head of the biceps brachii and its synovial sheath, the ascending branch of the anterior circumflex artery, and deltoid is inserted into the deltoid tuberosity. Now the next muscle is crocobranchialis. It is inserted into the rough area on the middle of the medial border. That is the crocobranchialis. The brachialis arises from the lower half. It arises from the lower half of the anteromedial and anterolateral surface of the shaft. Now the brachioradialis, next muscle is brachioradialis. It arises from the upper two-third of the lateral supracondylar ridge. We know this is the lateral supracondylar ridge and this is the medial supracondylar ridge. Now the brachioradialis arises from the upper two-third of the lateral supracondylar ridge. Next muscle is extensor carpi radialis longus, that arises from the lower one-third of the lateral supracondylar ridge. The lower one-third of the supracondylar ridge, that is the extensor carpi radialis longus, and brachioradialis arises from the upper two-third of the lateral supracondylar ridge. Next muscle is the pronator teres. The humeral head of the pronator teres arises from the lower one-third of the medial supracondylar ridge. And the superficial flexor muscles arise by a common origin from the anterior aspect of the medial epicondyle. That is the superficial flexor muscle of the forearm, and this is called the common flexor origin. Now the superficial extensor muscles of the forearm and supinator have a common origin from the lateral epicondyle. This is the lateral epicondyle, and here the two muscles are originated, the superficial extensor muscles of the forearm and supinator. Next is the anconeus, arises from the posterior surface of the lateral epicondyle, and the lateral head of the triceps arises from the oblique ridge on the upper part of the posterior surface, that is the posterior surface above the radial groove, that is the lateral head of the triceps brachii muscles arises, while its medial head arises from the posterior surface just below the, here is the radial groove, the posterior surface just below the radial groove, the medial head, and above the radial groove, the lateral head of the triceps brachii arises. Now the capsular ligament, it is attached to the anatomical neck except on the medial side, and capsular ligament of the elbow joint, it is attached to the lower end along a line that reaches the upper limit of the radial and conoid fossa anteriorly, and the olecranon fossa posteriorly. Here is the capsular ligament of the elbow joint. Capsular ligament of the elbow joint are attached. It is attached to the lower end along a line that reaches the upper limit of the radial and the conoid fossa anteriorly, and the olecranon fossa posteriorly. And the three nerves are directly related to the humerus. What are the nerves? First is the axillary nerve that are liable to be injured. First is the axillary nerve, which is along the surgical neck, then the radial, that is along the radial groove, and the ulnar nerve that is behind the medial epicondyle. The three nerves are associated with the humerus, which are liable to, which are prone to injury, that is the axillary nerve, the radial nerve at the radial roof, the axillary at the surgical neck, and the ulnar nerve behind the medial epicondyle, Now, the some clinical anatomy which are associated with the humerus. First is the common site of the fracture. What are the common site? They are the surgical neck, the shaft, and the supracondylar region, and it is supracondylar fracture. It is common in a young age, and it is produced by a fall on the outstretched hand. And head of the humerus, it is commonly dislocated anteroinferiorly. Head of the humerus commonly dislocated anteroinferiorly. This is all about the elbow, the muscle attachment of the elbow. Thank you. Please share, subscribe, and like my video. Thank you.